Message?
To be honest with you, I don't know. I haven't done research.
I mean, it is a mandate, right? And it's a healthcare mandate. It's not. Is it optional to the states? I don't know the answer.
There is a partnership that occurs between the state and the federal government. I can't tell you I'm an expert on that issue.
But is it a voluntary partnership? That's the.
Well, quite frankly, we can turn it down.
We can
say we're not going to match our 50% or our 70%, or today I think it's 90%. We can turn it down and just say no, we don't want anything to do with it. But whoever was the governor at that time when Medicaid came in decided that we would go forward with it, and that would be actually funding up to 135% of the level of poverty, and that's where we are today.
Is the gist of the argument that it's because it's pushing a private insurance, requiring people to buy private insurance, like Medicare is basically government run, government paid for?
Well, I'm going to let Lawrence handle that, but if it is a proper role for governments to mandate that citizens buy certain products, then I'm going to get potatoes in line for it just as quick as I can.
The specific, there are a number of constitutional questions that we are asking. What I'm trying to frame for you is one of the primary questions that we are asking the court to answer, and that is, under Article 1, Section 8 of the United States Constitution, the Commerce Clause, was Congress granted the power to compel citizens to buy health insurance? That's the critical question. Can we require that of them? That's beyond what the Commerce Clause has typically required of them. It's beyond the power that Congress has generally been granted. This is a novel legal question that we believe that the court needs to answer.
But that goes back to my 2% of my paycheck goes to fund Medicare, and yet you're not fighting that as unconstitutional.
But in this instance, the question is can we compel the citizen to purchase that? The only thing the citizen is doing, without any other overlay, is breathing. That's the question. It is the very fact that they are a person, that they are now being compelled under a penalty to be imposed by the federal government under its authority. Can it do that to the citizens of the state? That's the question.
Does the state?
No, wait a minute, John.
Sorry. Does the state have a fallback plan should the states fail in this lawsuit? How would Idaho respond should the Supreme Court decide that is the appropriate use of the card?
Well, it becomes the rule of law. And once it's the rule of law of the land, why, we're going to obey the law. That's what makes a republic work. And we'll do our level best to try to repeal it. And I think that's going to be the effort of the leadership in Washington, D.C. If they can't detour the Senate from continuing on their economically suicidal path, then they will do their level best to repeal the law. That becomes problematic, because if it's signed into law, and even if the House won, let's say, 38 seats, if the Republicans won 38 seats in the House this November and won sufficient number of seats in the Senate to turn both of them around to a majority, it's still law. You're going to need 2/3, because you know Obama is going to veto that bill. So the next line of attack has got to be go where the money is and not fund it. And if you don't fund it, people have a tendency not to work on things if they're not getting paid for them. Did you have anything you want to add to that on the legal side? Yeah, Brian.
The president has said that this is a debt reduction bill and that there's an overall savings in this bill. How do you respond to that? And then secondly, would the Republicans on Capitol Hill been better off working with the Democrats to get some of the stuff they wanted in this bill and to make it less onerous to the states and to everyone else? Or is this the right path? Saying no, voting no, the entire process, the best way for that bill to end?
Two-part question. The answer to the first part is I do not believe it. I absolutely do not believe that this is a debt reduction bill. I believe all of the hocus pocus and the magical mathematics that they put into that bill is not even close to reality. Let me give you one instance. You all might recall when I was in Congress, we passed Schedule D to Medicare, which was the pharmaceutical package. We were told, we were promised $385 billion over 10 years. Today it's over $1 trillion already. I suspect that this bill is more wrong by the Congressional Budget Office. They're more wrong in their guess on this than they were on that. And they had a lot more time to work on that, and not near the size of it. The second part of that question is, the Republicans, the minority did offer time and time again other resolutions that were free market oriented. The only bipartisanship about this whole bill, by the way, is the opposition to it. There was sufficient opposition. I think 40 Democrats voted against it, along with 100% of the Republicans. And so there was input offered by the Republicans. If you recall, when the summit was televised from Washington, D.C., there was constant input suggested and remedies that even if they would have taken it piecemeal instead of in one great big package. Let's vote on this. We all agree on certain things. We all agree on the previous condition coverage. All right, so let's go forward with that. Other things that we agree on, let's go forward with this, and then let's work on the things that we disagree on. But I would say voting no was not the only role that the Republicans played, and to characterize it that way, I think, is to be far short of what the truth is.